Welcome back. 18 American passengers from the cruise ship at the center of a deadly Hantavirus outbreak are back in the United States this morning under quarantine at top-tier medical facilities in Nebraska and Georgia, including one person who has tested positive and another who is experiencing symptoms. MSNOW reporter Britt Miller has the details.
For the first time in more than a month, some of the Americans caught in the middle of the deadly Hantavirus outbreak are waking up on U.S. soil. 16 are now at the University of Nebraska Medical Center. One patient who tested positive is in a specialized biocontainment unit like this one. The other 15 are being monitored in quarantine.
Over the next several days, passengers will undergo an initial health assessment.
And 2 passengers are at Emory Hospital in Atlanta, one person there showing symptoms. Meantime, several states, including Texas, California, and now Maryland, are monitoring people who were potentially exposed to the Andes strain on board the cruise ship Hantavirus. The World Health Organization now reporting 11 cases, including 3 deaths. But its director general is stressing
this disease is not COVID.
Passengers now in the U.S. can quarantine for up to 42 days, the incubation period for this rare virus typically carried by rodents.
We want to do this in the least restrictive way possible that is still safe.
CDC officials say anyone who doesn't show symptoms can leave.
They certainly have the option to stay here for the entire 42-day period if that's just the safest and most effective option for them. There's going to be an individualized decision plan for them to determine if it makes more sense for them to complete their 42-day monitoring period at home.
Epidemiologist Dr. Anne Remoyne, known for her research in emerging infectious diseases, says that may not be the best strategy to avoid the spread.
I don't think that we want to be so arrogant about what we know and what we don't know about this virus. Some of the information that I've heard suggests that spread might be a little bit easier than what normally we would have thought.
President Trump and Health and Human Services Secretary Robert Kennedy Jr. confident in the U.S. response.
We have this under control and we're not worried about it.
But it looks like it's just a disease that we've had around in a very small way for a long time. Not a good one to catch.
However, health experts say the U.S. withdrawal from the WHO and targeted cuts to the CDC could limit the ability to confront the crisis. Trump's picks for the CDC chief and Surgeon General still awaiting confirmation.
We've dismantled a great deal of our public health infrastructure, and as a result, we are much more vulnerable to any public health threat, any infectious disease.
As passengers adjust to life in quarantine, the ship's captain thanking them for their kindness.
I wish nothing more to everybody, guests and crew alike, to be able to go home safely and in good health.
The ship carried an estimated 150 passengers. Those back in Spain and France are now in mandatory isolation. Meanwhile, we're learning more about the identities of the 18 Americans. Their ages range from late 20s to early 80s, and 3 are New Yorkers. Back to you.